So I was asked the other day, for anxiety, is it better to go the medication route or the meditation route? Now, I'd say both have a place. So to look at this, I think you need to consider both short term and long term. So by far the most sort of common medications that you'll find yourself on if you've got a generalized anxiety disorder or a severe disorder would be your SSRIs, or selective serotonin reuptake inhibitors. Now these would be your sertralines, your citalopram, your fluoxetine or your Prozac. Now these medications in the short term can really work well for a lot of people. They've got a proven track record. They can help people get over the hump. They can help people feel better relatively quickly. Now, like any medication, they come with side effects, and in severe cases they can lead people to feel quite numb, quite emotionally numb. So what I'd recommend, medication or meditation, is look at meditation as a long-term maintenance tool. So something that if you do day in, day out for a long period of time, it's going to have a beneficial effect on your psyche, generally speaking. It's going to help you manage anxiety more effectively. It's going to settle everything down and give you a sense of space and perspective over the whole problem. So meditation, I look at it as something similar to cleaning my teeth. Like, I just do it daily, whether it be 5 minutes, whether it be an hour. It's generally somewhere in that bracket. I'll sit and I'll meditate because I know it's good for me. Now, there's been periods of my life when I've stopped meditating for weeks on end, and then it's a slow drift. You don't notice it, like not meditating for one day is not going to be a deal breaker, but not meditating for a week, I'll notice I'm more irritable. I notice my mind is more busy, and I notice things bother me more. So if you translate that to someone who's got anxiety, severe anxiety, starting a meditative practice as a long-term maintenance tool, like cleaning your teeth, like personal hygiene, it's just personal mental hygiene that can benefit you over the long term. Medication can be extremely effective for people in the short term, but I don't think any medication is going to do you a great amount of good if you're taking it for 10 or 20 years. Of course, there's certain exceptions, but generally, if you can manage your symptoms without taking the medication, you're going to be in a much better place. Now, I think a lot of these medications are too liberally prescribed. It's not really the doctor's fault. It's just the way that the Western medical system is built up. Here's a problem. These are the symptoms. Here's some medication that's going to take those symptoms away. Now, where my thought pattern differs is a lot of anxiety, a lot of depression, mild to moderate depression, are directly associated to lifestyle factors, to the way you conduct in yourself, to the behaviours, and certainly to the thought patterns. So meditation can be a great go-to tool that you can use by yourself as a long-term maintenance tool. If you need to go deeper, if you're needing to be on some sort of medication to stabilize your mood, now I'm talking about mild to moderate anxiety disorders, even severe anxiety disorders, and depression, mild to moderate depression, and other, health anxiety, OCD, sort of things like that. I'm not talking about antipsychotic meds. That's a completely different story. If you're on an antipsychotic, you're obviously under the care of a psychiatrist, and you need to stay under that care and you need to follow their advice. We're talking about something different. We're talking about these anxiety disorders. We're talking about OCD. We're talking about health anxiety, tomophobia, that sort of thing. So that can be really greatly affected by therapy, by shifting the beliefs that are driving it. Therapy can really unpick all of that for you and help you just not have those feelings anymore. So meditation or medication, I'd say in the short term, both. In the long term, meditation and therapy. If you are on SSRIs or beta blockers, we use beta blockers quite commonly as well for anxiety, and you're getting benefit from them, you keep taking them. You know, I'd never tell anyone to stop taking a medication. That's not my job. But what I would do is I'd help people see the medication as a shorter term crutch, and then make some lifestyle interventions using the breath, the behaviours, the beliefs, to be able to move you into a more comfortable state of mind, a happier state of mind, and then under the supervision of your doctor, you may be able to reduce and come off the medication. So there's a place for both, but why not use both? It's not one or the other. It's not, I'm just going to meditate and feel fine immediately, because that's not going to happen. It's going to take days and days and days and weeks of regular practice. We're talking about real lifestyle change here, not a quick fix. And that will see you right over time, with effective therapy as well, with talk therapy, hypnotherapy, CBT, NLP, different ways of thinking about things. Medication, brilliant for some people, can be quite damaging for others if they're used consistently and they become emotionally numb and they're reliant on that medication without making other changes. Have a great day.